Hi everyone, welcome to the seventh and last training module of Diversey on infection prevention. Today we're going to talk about the basics of the COVID-19 and what is important to know related to our disinfectants. I'm going to share my screen in a minute and then we will start. So as I said, we're going to talk about the basic of SARS-CoV-2 and the effective measure for infection prevention. But first, let me introduce myself. I'm Claire Khosravi. I'm the infection prevention application expert for Europe. I have a doctoral degree in microbiology and molecular biology. I'm responsible for the full range of our professional level disinfectants. I provide consultation on microbiology, EN testing, and medical devices. And I deliver training program for sales, marketing, technical manager, and application specialist at a European level. So today it's the last module of seventh training series of infection prevention. And let's start with a small link of a video from the TEDx. The title of the video is COVID-19. I really encourage you to have a look. On YouTube, you can find this video very easily, and it's really telling you a bit the history of the COVID-19 and where the SARS-CoV-2 is coming from. And what is coronaviruses? So coronaviruses are a broad family of viruses named after the crown-like spikes on their surfaces. They typically cause mild to moderate upper respiratory tract disease in humans, but can also cause more severe infection, such as pneumonia and other lower respiratory tract infections. Mildness caused by coronaviruses includes the common cold and influenza like illness, like the flu. Severe illness caused by the coronaviruses include also the severe acute respiratory syndromes, the SARS, and the Middle East respiratory syndromes like the MERS, and some pneumonias. So there are some coronaviruses that can be transmitted from animals to humans. And both the SARS-CoV and the MERS-CoV are believed to have originated in animals and were transmitted to people, causing the infection. So what's the status of the COVID-19? So here you can find a dashboard by the Center for System Science and Engineering, CSSE, at the Johns Hopkins University. So you can really easily follow the news on this website. And then if we summarize the cases at the date of this webinar, there has been more than 106 million infected people, so globally, with more than 2.3 million of deaths. So while much has been learned, our knowledge of SARS-CoV-2 is 12 months old. So there is still some conflicting information from different sources. So really only use credible sources for information, like World Health Organization, ECDC for Europe, US CDC for the US, and the country level ministries of health. Twitter, Facebook, and all the social media information is of questionable quality. So, not entirely unexpected, this is the third outbreak caused by a novel coronavirus in the last 20 years. Many experts have been warning of this risk for years. While the size of this pandemic is surprising, the occurrence of a coronavirus causing a panic is much less so. So, most experts thought an influenza pandemic was more likely. And when did SARS-CoV-2 emerge and start causing infection? So the first cases were reported in Wuhan, China in December 2019. Initially, a wet market was believed to be the source of the zoonotic transmission. And a review of healthcare patients recorded in China suggests that the initial cases may have been even earlier. Of course, the genomic analysis estimates that the SARS-CoV-2 diverged from an ancestor bat coronavirus 50-60 years ago. It did not come from a lab. And what about the outbreak prevention? So this is really what we are focusing on, and how the infection are transmitted. So person-to-person transmission, droplet transmission, so made when an infected person coughs, sneezes, or talks, and touching contaminated objects or surfaces. So for a lot of information, you can find, you can go on the ECDC website, so the European Center for Disease Prevention and Control. And how to prevent the SARS-CoV-2 transmission. So there are a number of measures that we need to take in order to prevent the SARS-CoV-2 transmission. So we need to wear the breathing mask. We need to, of course, do the social distancing. We need to do hand hygiene, ventilation, physical barrier, and we need to clean and disinfect contaminated surfaces. So in this training module, we're going to talk mainly about the last aspects of the cleaning and disinfection, because it's related to the infection prevention and control of our environment. And indeed, the environment plays a role in the risk of transmission of the SARS-CoV-2. So surfaces near us are often contaminated, and contaminated surfaces increase the risk of transmission, so either directly or through hands of others. So it is very important to practice hand hygiene and to protect our residents, our students, staff, and other. So we often get the question about the survival of microorganisms on surfaces when we talk about cleaning and the disinfection of contaminated surfaces. And this varies depending on the type of viruses. So you can see on this picture that depending on the viruses, you can have from 2 days of the influenza viruses to up to 7 days for the norovirus, for example. And there are, of course, many interests on how long SARS-CoV-2 stays on the surfaces. So there are several studies that, and they have been done under lab condition. They have investigated the environment survival of SARS-CoV-2, and they may or may not accurately reflect the reality of typical environment condition. But there are a good reference on the likely differences in survival by surfaces. So you can see here on this table several different type of surfaces like paper, copper, cardboard, cloth, glass, stainless steel, and plastic, with different numbers of days. But there are also another paper from Riddell who has showed even survival up to 20 days. But again, this testing was done in less realistic condition, for example, in the dark. So what do we need to do? What do we need to change during this COVID-19 pandemic? So, of course, we need to think of our product and our protocols, and we need to understand the difference between cleaning, sanitizing, and disinfecting. So cleaning removes the germ, the dirt, and the impurities from surfaces or objects. So works by using a cleaning product and water to physically remove the germ from the surface. Then when we talk about sanitizing, so sanitizing reduces the number of germ on surfaces or objects to a safe level as judged by the public health standard or requirement. And the last level is the disinfection. So the disinfection kills 19.99 to 19.999. So we have discussed about those log reduction in the EN efficacy training module. And this works by using a disinfectant product. So that will really kill effectively the germs on the surface or object. And it's also important to understand the challenges to proper cleaning and disinfection. So of course, we have budget constraints. We have some disinfectant that might be slow acting, so requiring a long contact time before to kill a certain pathogens. Limited cleaning ability of some disinfectant, and the reduction of efficacy if, for example, the disinfectant is binding with a cleaning material such as microfiber or cotton. Poor laundry practice that result in cleaning clothes that are less clean. The corrosiveness of some disinfectant that can cause risk to the user or damage some surfaces and fabrics. So just because you are using a disinfectant doesn't mean that you are actually disinfecting. So it is important to really take into account those parameters, that the germs are invisible, that you need to really have a look at the safety after the use of your product, that the disinfectant dries before pathogen dies. That's also an issue. The compatibility with cleaning tools, the inaccessibility of perhaps a disinfectant, and the incorrect disinfection dilution that can be dangerous because it can lead to improper use and a wrong efficacy of a product. So at Diversey, we have an overview within Europe that tells you which products are effective to clean and disinfect and to kill SARS-CoV-2. And just as a reminder, because we have seen that in the EN efficacy training module on how we can be sure that a product it's effective against SARS-CoV-2. So how does it work in Europe? So the viruses are commonly divided into two groups. So the enveloped in red and the non-enveloped here in green. And the European Committee for Standardization, so the CEN standard, the EN 14476, define the viruses that are considered the most resistant strains. And a pass against those strains is considered to cover the less resistant strains within the viral category. So most notably the envelope virus. So this is important to understand how those viruses have been selected. They have been selected by years of external testing, and they are the most resistant to the disinfectant. And that's why they are the representative strains, and every manufacturer must test their product against those viruses. So the SARS-CoV-2 representative organism, so as we discussed, there is 3 representative organisms for the non-envelope, so murine norovirus, adenovirus, and poliovirus, and 1 for the envelope virus, the Vaccinia virus. And each of those claims, so either virucidal activity against envelope, the limited virucidal activity, which is by testing only the murine and the adeno, and the full virucidal efficacy, all of them guaranteed an effectiveness against SARS-CoV-2 because SARS-CoV-2 is an envelope virus, and envelope viruses are easier to kill than non-envelope virus. But if we put that into like a pyramid schema, so we can see that we have the first level of efficacy of a product against viruses, so the virucidal against envelope virus. Then we have the second level, which is the limited virucidal claim. So that means the product is effective against the envelope and murine, norovirus, and adeno only. And then the last level of virucidal activity is the full virucidal claim, when a product has been tested against adeno, polio, and murine norovirus. So that means this product is effective against envelope virus and all the non-envelope viruses. And this is what we have with our Oxivir XL product range. Then we need to, of course, either improve or strengthen our procedure to really enhance our cleaning and disinfection. So we need to clean and disinfect the major areas with precisely selected products that are effective against viruses, with clear delineation to facilitate proper performance of the cleaning activities. For your working staff, we need to identify the key touch points that we need to disinfect with, for example, a wall chart with the critical common touch point that should be disinfected. We need to set up practice to consider to reduce the risk with hygiene risk assessment, to really identify the practices, whether they are being done correctly or not, and identify the key risk area within the facility. And for that, we have available materials that will really help you to increase the hygiene compliance with also the key touch points on where you need to disinfect and when you need to disinfect, depending on your facility, whether it is in offices, in the long-term care facilities, in a school, or other type of sectors. And of course, it's important to follow relevant platform where we can find the latest status of the COVID-19 pandemic, like the ECDC. And there you really have an updated data sets that are collected every day. And of course, I really encourage you to really locate your local health department within your region, where and to follow also their guidance. So thank you for your attention. This was our last training module of Diversey's training series on infection prevention. If you have any question, I really encourage you to contact your Diversey representative. And thank you very much for your attention.